In this next case, you'll see the patient is also dentate, and the challenge for him really is to try and work out a plan. Firstly, when a patient is dentate, we always try and work out whether there is a possibility to save the teeth. But in this particular case, the teeth were quite hopeless. Even though we went through a number of options where some teeth could be saved, we faced a problem in our ability to achieve a nice aesthetic and functional result for him. What you can see on the x-ray here is that he's got those 6 anterior teeth in the upper, but the bone quality is very poor. You can see the dark shadows around the roots of the teeth and the differences in the density of the bone. So you know straight away that this area is going to be very challenging. You also see those large sinuses, and they extend quite far forward. So there is a lack of bone, but there is also a very poor quality bone. If we look at the zygoma bone, you can see that it's got a reasonably good height, but when you look at the cross section, it's very, very thin, and there is not really a lot of bone there. So we've got ourselves a bit of a situation because the zygoma implants are not going to be anchored in a great deal of bone, and we need to have some additional support right from the crest. That's going to be really important, really critical. I thought I was going to be able to achieve this, so I planned this case for 5 implants on top. The zygomas extending to where the roots of the molars are, and then having 3 implants in the front and another zygoma on the other side. And the critical part here, like I said, is going to be to have some support at the crest. Otherwise, we're only relying on the implant anchoring into a very thin zygoma bone, which wasn't going to be ideal. So the plan for this patient was to put 5 implants. I'm going to rely on the zygomatic bone, even though it's very narrow and thin. If I can get some crestal support from where the molar is, then that would be quite advantageous. And potentially I can use the implant Zaga round, which has some threads which can be anchored into the socket. So that was the plan. I knew the bone was going to be very poor, and I wanted to anchor this zygomatic implant in 2 spots, in the cheekbone as well as in this socket of the molar. But what you can see is that both molar teeth, the 6s and the 7s, are protruding right into the sinus. So one of the things that you need to be careful of is when you take those teeth out, that entire socket can collapse, and then you've got a bigger issue to deal with. So let's see what actually ended up happening. You can see that I actually encountered that problem during surgery. Once I removed the teeth, I had an open sinus because everything crumbled around those molars. And then I no longer had this crestal support. When the zygoma bone is so narrow, I really don't want to do a sinus crush where the implant is only supported by this bone. So in this case, I added additional implants. You can see those pterygoid implants in the back because I lost that crestal support for my zygoma implants. What you can also see from this x-ray is that I positioned the 2 implants in the canine areas, but they are a different type of implant. Originally, I planned to put just normal standard implants into the alveolar bone, but I wasn't able to achieve good stability. So I actually had to take the implant out and go in with a longer implant. So I placed a transnasal implant on each side, and with this, I was able to achieve good stability because I used 24mm implants. So in combined stability for this case was excellent, but to start off, this case was very compromised, and there were some challenges that I didn't expect that came up during surgery, which meant that I had to put some additional support in order to have a better outcome.